When you think of plastic surgeons, you think of facelifts and breast augmentations. Well, a lot of that does happen, but there's a whole lot more going on than we might suspect. Tonight, we take you behind the scenes of Hall and Wrye plastic surgeons to talk about the things we don't normally think of. Not all surgeries are elective, and not all doctors are equal.
The most common thing we do is breast surgery, whether it's breast augmentation, breast lift, combination of both, facial rejuvenation, mini facelifts, full facelifts, brow lifts, eyelid surgery, tummy tucks, liposuction. I mean, really everything that you can imagine we offer here at Hall and Wrye.
But we are also intimately involved with reconstructive procedures.
The most common thing that we do reconstructive-wise is breast reconstruction.
A woman who has had breast cancer and has had a mastectomy.
As part of their treatment, they lose their breast, or a breast is removed to treat the cancer. We can reconstruct that breast.
I had breast reconstruction. I was diagnosed with breast cancer at 31, had a double mastectomy. I came to Dr. Hall and Dr. Wrye to help me through the reconstruction process. They've exceeded my expectations to make me feel as normal as I can. I wanted to share my story so that women who go through an experience like I did with breast cancer and having a mastectomy, that there's so many choices out there for reconstruction.
In addition to using breast implants, we are also very happy to be able to provide autologous reconstruction, meaning we'll use a portion of the patient's own tissue.
We can help a woman feel whole again.
Where you can ultimately, in the end, feel as normal as possible and as complete and feel like you have your womanhood back.
We perform many different types of reconstructive surgery.
Patients who have had severe injuries such as burns or injuries that have damaged their limbs or their hands or their face,
disfigurement from a motor vehicle accident, a traumatized arm, a traumatized leg that we save and doesn't have to be amputated, restoring function to a hand so that a carpenter can go back to work. I mean, you name it and we do it. So reconstruction is a very big part of what we do.
These are injuries that we feel very adept at dealing with. These are some of the most difficult and challenging operations, and also some of the most rewarding operations that we do. These are the operations that we feel give us a true sense of responsibility in the community and of doing our duty as physicians.
When it comes to skill, these two doctors not only talk the talk, but they walk the walk.
One of the things that Dr. Wrye and I have done is we have become the first plastic surgery practice to perform robotic surgery, but we're the first ones to do it in the world. The precision of the robot may translate into less pain for the patient and less recovery time.
We're incredibly skilled surgeons. I can be perfectly honest when I tell you, I've never met a better surgeon than Dr. Hall.
Whether you're having an elective surgery or a non-elective surgery, there are some things you need to consider when choosing a surgeon. Our doctors stress the importance of board certification and offer some really good advice.
Board certification in plastic surgery is conferred by one board, the American Board of Plastic Surgery.
Seeing a surgeon that's been certified only by the American Board of Plastic Surgeons, which is the only legitimate board that governs plastic surgeons, will ensure a basic level of competence.
That confers safety. That's the main thing that we're worried about when we're talking about board certification.
And we adhere to the ethical guidelines that are set out by the society. That's a first step, however. I think the most important thing is meet your doctor. Talk with your doctor. Make sure that he or she understands your worries, your concerns, and has a plan to take care of your worries or concerns.
In addition to elective surgeries, non-elective surgeries, and robotic surgeries, we also found out that behind the doors at Hall and Wrye Plastic Surgeons, they are changing people's worlds.
My first procedure was I had a upper eye lift and I had a lower facelift. My other procedures, I had a breast reduction as well as a tummy tuck.
I feel amazing after I had my mommy makeover. I feel great. I feel like a new woman.
And I felt it was time to do something for myself. So I am a very healthy person and I wanted to look as healthy as I felt. Now that I've had this procedure, I feel fabulous. My confidence level has increased. I'm on a new journey in my life, and I just look forward and I hold my head up high, and I'm just so thrilled and so grateful to have had this procedure. Thank you, Dr. Hall and Dr. Wrye. You've made my world a better place.
You made my world a better place.
You've made my world a better place.
Thank you, Dr. Hall and Dr. Wrye. You've made my world a better place.
You've made my world a better place.
The next time you think of a plastic surgeon, we hope you'll think of more than just big boobs. And the next time you're choosing a surgeon, make sure you look closely at what's going on behind the doors, because that surgeon has the ability to change